Welcome to The Explainer. Today, we're tackling the world of medical coding, specifically the CPT 9 series. Now, I know, it can feel like trying to learn some kind of secret language. But what if I told you there's a key, a playbook, really, that can unlock the entire system? So let's just start with this big question. Is getting the right code an art? Some kind of gut feeling that you develop after years and years of practice? Or is it a science with a clear, logical system that really anyone can learn to follow? Okay, let's dive right in. We've got a roadmap here that's going to show you exactly why it is a science. We'll start with that secret language. I'm going to give you 4 universal keys, and then we're going to put them to the test on everything from simple immunizations to complex cardiology. And I promise, by the end of this, you'll have the blueprint to decode it all yourself. All right, so let's get right to it. We're going to start by revealing the secret weapon, what I like to call the Rosetta Stone for the CPT 9 series. And these aren't just a few helpful tips. These are the 4 universal keys that form the bedrock of the entire system. And here it is. This is the whole game. This massive, seemingly complicated system, it all boils down to just these 4 variables. That's it. You've got patient status, like their age or if they're a new patient. Clinical time, pretty straightforward. How long did the service take? Setting and delivery, so were they in the hospital or outpatient, that kind of thing. And finally, component stacking, which is just a fancy way of asking how different services get combined. You master these 4, you've mastered the whole playbook. So, theory is great, but let's put these keys to the test. We're going to open up our first case file, immunizations. It's the perfect way to see how this logic works in a really clear, contained example. The basic formula here is so simple. It's always the product code plus the administration code. Always. So if you look at this MMRV vaccine example, it's protecting against 4 different bugs, right? Well, the rule is each organism counts as one component. So you use a base product code for the first one, the measles part, and then you just use add-on codes for the other 3, mumps, rubella, and varicella. Simple as that. And this right here, this is the perfect little decision tree for picking the right administration code. It's a logic gate in action. For instance, say we have a 25-year-old patient. We start at step 1. Okay, they're over 18. Now for that age group, counseling doesn't actually change the code, so we skip right to step 3. From there, it's just about how it was delivered, and that points you directly to the final code. Now you might be thinking, sure, that works for immunizations, but what about the really complex stuff? Well, that logic wasn't a one-off. The exact same principles apply across totally different medical fields. So let's see how our 4 keys, patient status, time, setting, and stacking, can unlock some of these bigger, more complex specialties. Okay, take dialysis. All we have to do is follow the flowchart. Our case here is an inpatient with end-stage renal disease. So, level 1, inpatient. That leads us to level 2, the 909 category. The modality was hemodialysis, which makes that 4th digit a 3. And because it was a repeated evaluation, the 5th digit becomes a 7. And there's our final code, 90937. No guessing, no interpretation, just pure logic. And for outpatient dialysis, it gets even easier. It's basically a grid like playing Battleship. You just find the patient's age in those orange rows on the left, and then you find the number of monthly visits in the blue columns up top, and right where they meet, boom, there's your code, just waiting for you. It's a perfect example of that first key, patient status, doing all the work.
Now let's jump over to psychiatry. The difference between these 2 big evaluation codes, it all boils down to one simple question. Were medical services provided? If that visit included things like a physical exam, or prescribing meds, or looking at lab work, you use the code on the right, 90792. It's a simple binary choice based on the service components.
And here, our second key, clinical time, is the absolute star of the show. For crisis psychotherapy, time is literally everything. Anything less than 30 minutes, you can't even code it. Between 30 and 74 minutes, you've got your base code. But check this out. The second that clock hits 75 minutes, that single minute triggers a whole new add-on code. And you get another one for every 30 minutes after that. Over in ophthalmology, there's what I call a golden rule that just makes everything click. An exam becomes a comprehensive exam if and only if the doctor starts a diagnostic or treatment program. So in our example, the doc starts a plan for a new cataract. That instantly makes it a comprehensive exam. It's that simple. And for allergen immunotherapy, you just have to ask, okay, what exactly did the provider do? Did they only give the injection? That's category 1. Did they prepare the antigen and give the injection? That's category 2.
Or did they only prepare it for someone else to inject? That's category 3. In our little quiz here, the patient brought their own stuff, so the service was injection only, which leads us right to our answer. All right, now for our fourth and final key, component stacking. This is where we look at the rules for how you combine or don't combine codes when multiple things happen together. Now, this is where folks can sometimes get tripped up, but again, it all follows a very clear logic. So in some situations, you actually split the code. A standard ECG has what's called a global code, 93000. That covers doing the test and the doctor's interpretation. But if one clinic does the test, that's the technical part, and a doctor somewhere else reads the results, the professional part, well then you split that global code into its 2 pieces. The work is split, so the code is split. Makes sense, right? But then for other things, like these complex cardiology procedures, the logic completely flips on its head. Here, you don't add codes together. The most complex procedure actually absorbs the simpler ones. So if a surgeon does an angioplasty, then an atherectomy, and then puts in a stent, you don't code all 3. You only code for the highest level of work, the big one, in this case, placing the stent. And this slide just lays out those 2 opposing philosophies perfectly, side by side. For the ECG on the left, you split the work, you split the code. For a PTCA on the right, you add more work, and the bigger procedure absorbs the smaller one. It's just 2 different rules for 2 totally different clinical scenarios. And this absorb logic, it doesn't just apply to cardiology. We see the exact same thing with infusions and injections. There's a really clear hierarchy of complexity, right? All the way from a simple bag of hydration fluid up to a highly complex chemotherapy drug. You always select the code for the highest level of service you gave in that session. You don't get to bill for hydration if you also gave chemo. The chemo code trumps it every time. And there you have it. We've gone on this whole journey from seeing medical coding as this impossible secret mystery to understanding it for what it really is. A totally logical system that's just based on a few universal rules. Because ultimately, every single case we've looked at today, it doesn't matter if it was psychiatry or cardiology or immunology, it all comes back to these 4 fundamental questions. Who's the patient? How long did it take? Where and how is it done? And what different parts were involved? And that, right there, is the most important thing to take away from all of this. Mastering this playbook isn't about the impossible task of memorizing thousands upon thousands of codes. No way. It's about learning how to apply a logical system, a universal set of rules, to any situation that gets thrown at you. So we'll just leave you with this final thought. You've basically just been handed the decoder for a system that seems unbelievably complex from the outside. It makes you wonder, right? What other complex systems are out there in technology, in nature, maybe even in finance, that are just waiting to be understood by finding their few simple universal rules?